Good morning, good afternoon, or evening to everybody, and welcome to today's webinar on the global food and hunger crisis. My name is Katlego Muhuba, and I will be your moderator today as we delve into the urgent challenges surrounding food insecurity, nutrition, and gender disparities. As many of you are aware, climate change, extreme weather events, conflicts, and economic disruptions have fueled a crisis that now affects 1 in 11 people worldwide. That is 733 million individuals facing hunger as of 2023. If we don't act swiftly, the Food and Agriculture Organization warns that millions more, particularly in Africa, will continue to suffer from chronic hunger. Today's session will explore the broader impacts of food insecurity with a particular focus on how gender norms exacerbate vulnerabilities. We'll hear from experts about the interconnectedness of women, children, and marginalized groups in the struggle for food security and the systemic changes that need to be made to address these issues. We hope this discussion will spark new ideas and collaborations as we seek sustainable solutions to this crisis. And so to begin our conversation, I invite Reverend Nikki to lead us in prayer.
Thank you, Kat Lego. Greetings, everyone. Let us quieten our hearts as we go to God in prayer. Manna, bread of life, you offer food to the hunger, succor to the weary. We know you as one who does not allow your children to beg bread. And yet at times we wonder where you are, whether you're able to see or hear your children, for so many are hungry and crying and dying. Manna, bread of life, living water, refreshing wine. We pray even now that you would trouble our hearts so that we will not be those who gather only for ourselves, leaving nothing behind for those in need. We pray also that you would help us to remember that as we leave the gleanings for those left behind, that we would help them and ensure that their needs are met. Manna, bread of life. Join us as we break this hunger cycle, transform our hearts, our lives, our souls, so that we may be our siblings' keeper, that the hungry may be fed, and that there is food and refreshing for all our souls. Guide our discussion, and even more critically, guide our actions, we pray. In the name of Yeshua, amen.
Amen. Thank you, Reverend Nicole. And so for our first session, we will have two speakers. We will hear from Mrs. Dorothy Nyanchiwania, who is a registered nutritionist at Dedan Kimathi University in Kenya. Dorothy is a researcher in the area of non-communicable diseases and maternal and child health and nutrition. Welcome, Dorothy, and thank you.
Thank you, everybody. It's a great joy to be here, even as we explore the aspects of food, nutrition, and health on this World Food Day. As you've heard, I'm from Kenya, focusing on the area of non-communicable diseases and maternal and child health. I request that we have the presentation so that we can proceed together. Okay. So thank you for sharing the screen. As we are aware, the theme for this year, World Food Day, is right to food for a better future, while we are leaving no one behind. And of course, trying to see where we are as a world in terms of food and nutrition crisis. And of course, looking at the health impacts of the issues of food and nutrition crisis. Now, as a way of introduction, my outline will be, we will look at the contextual global food and nutrition health crisis. Next slide, please. We will also look at examining the effect of undernutrition, but basically I will be looking at the effect of malnutrition, the general aspect of malnutrition on the entire population, cutting across the child and also the issues of general public health. We will look at a number of public of health-related challenges, the challenges that are related to accessing nutritious and healthy foods, and of course, how these challenges are affecting billions of people worldwide. And we will give a special attention to the most vulnerable groups, especially vulnerable to the issues of food security and nutrition. That is the children who are below 5 years of age, and the women, particularly the pregnant and the lactating women. Let's move on to the next slide. Now, as I've already indicated, when we think about the global challenges that are affecting us, we are thinking about the issues of hunger. We are looking about the issues of food insecurity and the issues of malnutrition. Now, the hunger, most of us are used to the images that we see for the malnourished or the people who are looking malnourished, but we have both the seen and the unseen, the hidden hunger, both the macronutrient deficiencies, people who are lacking inadequate amount of foods, and not only food, but also the micronutrients, mostly which arise from the fruits and vegetables. When we think about the global challenge of malnutrition, we are looking at both undernutrition and overnutrition. And as we are aware, initially we used to think about the undernutrition as the only aspect of malnutrition. But now we are thinking about the triple burden of malnutrition, especially in the developing countries. We are thinking about the overweight, obesity, the underweight, and of course, the issues of micronutrient deficiencies. The other global challenge which is here with us is the aspect of food insecurity. And as we will be looking at later in the presentation, we will realize that we have the challenges of people accessing adequate and nutritious foods in the entire, in the households. And we'll be looking at what factors are contributing to the food insecurity and probably what response we may have. Let's look at the next slide on where we are in terms of the attainment of the Sustainable Development Goals. Because when we think about food security, when we think about nutrition, when we think about health, we are anchoring our thoughts on the SDGs, and particularly the SDG 2, which aims at, providing food and nutritious food and eliminating the issues of hunger by the year 2030. But if we were to ask ourselves, where are we as a globe? Of course, there was a very good progress all the way until 2020, before COVID. So we were on track pre-COVID, but after 2020, we are still off track when it comes to the attainment of the SDG 2, the zero hunger. And according to the 2023 report, actually we have a huge number of people who faced hunger in 2023. Between 713 and 757 million people, they faced hunger. And actually out of these, it means this statistics shows that 1 out of every 11 people in the world. And these challenges are, worse when it comes to other parts of the world, like the sub-Saharan Africa, where 1 out of every 5 people experienced hunger when it came, according to the 2023 statistics. Now, there are other parts of the world, like in Asia, the issues of hunger remained unchanged, while there were notable progress that were made in other parts like the Latin America and the Caribbean region. This is according to the Bill and Melinda Goalkeepers 2024 report on how to nourish a warming world. And it is sad to see that actually 1 out of 1 out of 5 people in Africa are still hungry. On the next slide, we see that as we are on a race to nourish a warming world, we have already mentioned that malnutrition remains the world's worst child health crisis, and not only the child health crisis, but even across the population. As I've already indicated, we have issues of the triple burden of malnutrition, the overweight and obesity, the underweight, and the micronutrient deficiencies. So malnutrition actually is the world's biggest health crisis. And the challenges of climate change have actually made it even worse or has made it harder to try and solve this puzzle of eradicating malnutrition. And as we could be aware, is that one of the main causes of malnutrition actually is the quality diet. And when we think about the food systems drivers of a healthy diet, one of the key drivers is the quality diet. And in this World Food Day, Food and Agriculture Organization has been advocating that it is not just the type of food that we eat. It's the aspect of a nutritious diet, diet that is affordable, one that is safe, culturally acceptable, diverse in terms of, the food groups that one consumes. And not only that, but it is also sustainable. So this has been a challenge, even as we aim at, nourishing a warming world. Let's see on the next slide. The Sustainable Development Goals are closely interlinked. When we think about the SDG 1 on poverty eradication, when we think about the zero hunger, when we think about, the good health and well-being, they cannot coexist, they cannot exist without one another. And the issues of food insecurity have contributed greatly to malnutrition, whereby globally we see that 2/3 of the world children, that is actually more than 400 million kids, are not getting enough nutrients to grow and thrive. And we have 148 million children who are stunted and those that are wasted. And these are the most severe forms of chronic and acute malnutrition, according to the World Health Organization 2023. Now, what happens when malnutrition kicks in at an early age is that it prevents the children from attaining their optimal growth. Because very early in life, we see the child requires some key nutrients for brain development, which if they are not available, it means that then their development is altered. And when a child dies, evidence shows that half of the time, those children are dying because of malnutrition. So looking at the aspect of interlinking issues of food security and malnutrition, we realize that they are closely linked and one cannot actually be attained without the other. If we have to attain the SDG 1, then we have to work towards the SDG 2 and SDG 3, among others that are closely linked. This is on the child nutrition. The next slide shows us that the entire population also is affected when it comes to issues of food security. Now, food insecurity means that the household probably is not in a position of acquiring the right amount of diet in terms of quality and quantity and safe. And projection shows that 582 million people will be chronically undernourished in 2030. These are just the projections according to, the report that I had already indicated earlier. And this points out the immense challenge of achieving this SDG 2. And this actually number is quite high because it represents more than 130 million, more than the people that were undernourished before the COVID-19, when we started getting off the track of attaining the SDG 2. And out of these 53%, it will be concentrated in parts of sub-Saharan Africa. This is quite alarming, and it should be helping us to think about how to, how to address these challenges, even as we will be looking at it later. The next slide shows us the other global, concerns such as the obesity, the other different forms of malnutrition, the global health crisis where we are in. There is an increasing burden of overweight, obesity, and micronutrient deficiencies across the population. And these are the major risk factors to the lifestyle diseases that we talk about, the cardiovascular diseases such as the hypertension, diabetes mellitus, and others. When we think about these lifestyle diseases, they are mostly linked to these aspects of overweight and obesity and other micronutrient deficiencies. So like in cancer, it is like here in Kenya, cancer itself is the second leading, causes of the mortalities that are associated with the non-communicable diseases, of course, thinking also about the cardiovascular diseases. So if we manage or if we tackle the aspects of food insecurity, it means that we are having more healthy diets, and then people's, malnutrition, the malnutrition rates are reduced, and also the non-communicable diseases are also reduced, or in other words, they are managed at some point. So what are some of the challenges that are affecting this access to the right, nutritious, and healthy diets? Help me to move to the next slide so that we can explore 4 factors that I thought. I know there are so many, but because the webinar, of course, requires us a shorter time, we can focus on the key or the main challenges that are affecting the access to the nutritious and healthy diets globally. Now, one of them is the nutritional vulnerability across the population. Now, the pregnant and lactating women, they are one of the most vulnerable groups across the population. This is because, of course, of the increased micronutrient requirements during pregnancy, such as the iron and folic acid, iodine, calcium, and vitamin D. There are both macro and micronutrients requirements increase as soon as a person is pregnant or as soon as a person has given birth and they are lactating. And comparison of the food insecurity status of men and women shows that the prevalence of food insecurity has remained consistently higher among women than among men globally, and of course in all the regions. And this tells us why then there's need to refocus on the pregnant and lactating women, because they are generally nutritionally vulnerable, even besides these statistics that are showing that women are more vulnerable than men. Nutritionally, they require more nutrients, especially in those when they're in those physiological states of pregnancy and in breastfeeding. The other category of people that are, rapidly, that are nutritionally vulnerable are the under 5 children. As I indicated that in the first 1,000 days of life, this is between conception to 2 years, there's a lot of rapid growth that happens. And actually a recent study has shown that even the long-term health complications such as these non-communicable diseases we are talking about, they set in those first 1,000 days of life. So as we think about feeding the population under 5 or under 2 years, it is such a critical period because we are feeding the future. If we are improving the nutritional outcomes in the first 1,000 days of life, that is in pregnancy and in the first 2 years, then it means that we are thinking about a healthier future and a healthier generation altogether. The second challenge that we think about is the economic inequalities that exist worldwide. More than 1/3 people in the world, that gives us around 2.8 billion. They could not afford a healthy diet in 2022. Now, these inequalities are clearly evident with the low-income countries having the largest percentage of the population that is unable to afford a healthy diet. Compare the 71.5% with a 6.3%, because like for the low-income countries, 71.5% of people were not able to acquire a healthy diet. compared to a high income, or 6.3% of the people who are living in, in the high income countries. So these economic inequalities dictate the amount of, the number of people who have that access to very affordable, healthy diets in our world, in the world that we are living in today. The third challenge, which is affecting the access to nutritious, healthy food system, is the issues of the broken food systems. The Global Alliance for Improved Nutrition in 2024 report actually showed that most of the countries' food systems are broken. What this means is that there is need to have, food systems transformations. The food systems that, are availing adequate amount of nutritious foods across the population, which are accessible in terms of, finances and all that. And for us to think about, repairing the food systems, it requires what we call the systems thinking, because it is an interconnected part of aspect. As we were looking at the SDGs, we cannot think about food systems or the agri-food system without thinking about the health system. We cannot think about it without thinking about the water and the other ecosystems. So it requires what we call the systems thinking, where people, stakeholders from different parts of the economy comes together and works towards ensuring that the food systems actually are strengthened in order, in terms of their resilience, so that they can propel, or they can provide adequate and healthy diets which are affordable, and they are available to all across the population. And the last challenge that I would like to think about, this one I just categorized it as many others, the other drivers of food insecurity and malnutrition. The conflicts and wars, such as the Ukraine wars, which have just, affected majorly the food systems and even the malnutrition levels. The climate variability and the extremes. We are saying that climate change is here, and actually it is here to stay. And the aspect of high cost of healthy diets and economic slowdowns, COVID-19 crisis, aspects of urbanization, which are straining the resources of the people in the urban area. And of course, not only the resources, but also the food systems. So all these challenges are affecting, or they're the ones that lead to limited access to the nutritious, healthy food. And remember, we cannot talk about food security without thinking about the accessibility and the affordability and also the sustainability. So if we have to attain all the pillars of the food security, then it means that we have to look at all these challenges that are leading to these limitations. Lastly, in conclusion, I would just let's look at the last slide as I conclude. The 2024 theme, the right to food, tells us that we have a call to leave no one behind. Actually, we have to think about how to bring together all that we are talking about. And I would like to close with the words of Bill Gates, who said that even if somebody asks me every other time what solution I would offer, I would just tell them the same answer. I would just solve the aspect of malnutrition. Thank you so much, and it has been a pleasure.
Thank you, Dorothy, and thank you for contextualizing the global food, nutrition, and hunger crisis and alerting us to the importance of systems thinking to address these issues. Our next speaker is going to be Emma. Emma Raman is an advocate for social justice from the Presbyterian Church in Trinidad and Tobago. She studied liberal arts at King's College in London and continued contextual theological studies at St. Andrew's Theological College in Trinidad and Tobago. She serves as the secretary for the Sold Out Servants Youth Missions Group, a grassroots group in Trinidad and Tobago, where she works with underprivileged women and children who face deep socioeconomic injustices affecting their health, nutrition, and well-being. Emma will be speaking to us on gender, food, and nutrition. Thank you, Emma.
Thank you, Katlego. And as we commemorate World Food Day today, I would be speaking on gender, food security, and nutrition, specifically how gender norms exacerbate food insecurity and malnutrition for women and children. Secondly, the gender gap in food security and the role of women as food producers and providers. And thirdly, some recommendations for a gender-sensitive approach to food security and nutrition. So, according to Australian sociologist R. Cornell, there's a relational approach to gender that provides us with uh, an insight into how we can view this issue and its relation to food security and nutrition. So Connell defines gender as a pattern of social relations in which the position of women and men are defined. The cultural meaning of being a man and woman are negotiated, and a relational approach to gender demonstrates how different circumstances, such as food security and nutrition, can influence women and men's health and illnesses. Therefore, gender relations are defined as the relations of power and dominance that structure the life chances of women and men in specific social contexts. And so, in an article, Vascasmi explores the gendered reality of the double burden of malnutrition in Indonesia. And now this study doesn't represent the entire population of Indonesia or anything for the world at large, but in this specific study, the man is perceived as dominant in the household and thus influences the family's eating behavior. And this is exemplified through the fact that men are the primary breadwinners for the home and their nutrition is prioritized since economic stability depends on their health and well-being. And this is an example that demonstrates gendered power relations in action. Furthermore, children are prioritized in receiving food first because they are in a period of growth and thus need help to develop a healthy condition. And therefore, the gender norm in this context is that women naturally put themselves after the family by eating last, which does not ensure proper nutritional needs are met. And women lack significant power both in society and their households, despite being highly active in generating income and in providing for their household through the care economy. Now, in my work experience in Trinidad and Tobago, women in economically unstable households with abusive or negligent partners have to choose between feeding their children or eating for themselves. And often they will not eat to allow their children to have more than one meal a day. And now a balanced meal for proper nutrition isn't even a consideration at this point because they need to provide the most amount of food, and the cheapest and most convenient option is often the best. Thus, because of the increased cost of living and affecting food items and all of the other transport issues to get to a grocery, families get more food and multiple meals by purchasing fast food as opposed to cooking a balanced meal. And in this situation, the immediate priority of feeding the household outweighs the long-term nutritional intake, thus many times leading to really poor nutrition and either obesity or underweight. Now, the power relations of gender within society impact the reality of these families facing food insecurity and grappling with the effects of malnutrition as exemplified above. So the second theme that I was asked to present on was the gender gap in food security and the role of women as food producers and providers. Now, Harris Fry notes that qualitative literature indicated relative earned income was an important determinant of household food security and dietary quality, but that gender norms determined participation in income generating activities limited this. So the question is, are women allowed to leave the house to work in the informal economy or in agriculture, or do they have to stay at home? and provide in that context. So studies in Malawi, Tanzania, and Nicaragua showed that there was a common perception that men spent too much of their income on personal expenses, and women who were able to generate income were forced to use it for the household to buffer against the shocks of income, therefore improving the food security for the entire family. And this identifies another gender norm, that there's a lack of accountability in the part of men's finances, while women are forced to overwork themselves to make up for this shortcoming. Furthermore, studies have men, in these studies, men have the financial independence to use their income freely, while women's income are tied directly to the functioning of the household. So at a societal level, gender equity could reduce poverty and improve nutritional outcomes through increases in economic equality between households, but the lived realities reflect a different story. In woman-headed households, they're more vulnerable than male-headed households in terms of awareness, workload, and food insecurity. So while increasing women's relative income or employment increases food security, women's comparatively higher work burdens from work that generates income, as well as work within the household, as the lack of household support from men for childcare, cooking, and taking care of the house were linked to poorer diets for women. Essentially, women prioritize getting work done above eating. And in the article, Feminization of Hunger and Climate Change, Patnaik examines how women experience food insecurity in farming households in rural India. So, although women play a crucial role in ensuring food security, they are the most deprived when it comes to adequate access to food. Women suffer higher rates of macro and micronutrition deficiencies, which are intensified by cultural practices that prioritize food provision to children and adult men, as reflected in the study from Indonesia. Now, coping strategies such as reducing the number of meals, skipping meals, and subsidizing regular food with less preferred food are higher among woman-headed households than male-headed households. And in regards to women as food producers, in the agricultural field, women took part in almost all activities, but some activities were exclusively carried out by women, such as weeding and harvesting. And this is in a certain territory in India, and most of the activities performed by women were manual in nature compared to those performed by men. So men would do tilling and harvesting with equipment and technology, whereas women's work were more time consuming and strenuous because weeding and harvesting took uh, manual labor. And so women's comparatively higher work burdens at home because they have to take care of the house as well as within the agricultural sphere as they generate income, again links to poorer diets for women. So some recommendations for gender-sensitive approaches to food security and considerations on nutrition would be that gender commitments and gender diversity advocacy and tackling the desperate experiences of gender must be more than just tokenism, because globally and regionally, women are slightly more food insecure than men, and thus ensuring women's food security, nutrition, and income is vital for increasing productivity, improving health, and enhancing the well-being of families and households. Women's empowerment positively impacts child and maternal health, which lead to improved nutrition. So on a macro level, advocating for gender equality issues in international and national policy dialogues so that women can be empowered and all forms of malnutrition can be eradicated. We can call for design of gender responsive interventions with the aim of providing women and men with the same access to food, productive resources, education, and decision-making power, and target both men and women in nutrition, education, and training programs on food production, aggregation, processing, and marketing, as well as support behavioral change for food waste production and healthy dietary habits. And on a macro level, we recognize that women's unpaid care and productive work and adopt tailored measures to address their work burden and support the equal distribution of unpaid care and domestic work, grow community gardens in churches with local vegetables and fruits to alleviate the need in people's homes, and identify and combat existing gender stereotypes and discriminatory gender norms that affect food security, nutrition, and agriculture. Thank you.
Thank you, Emma, for highlighting the interconnectedness of gender, nutrition, and food. We will now get into our second session, which will be a breakout room interactive session. We will have 15 minutes to interact with one another in different groups. We will have 3 groups. You will all be assigned randomly into a room, and we will focus on systemic transformation for sustainable food systems in these breakout room discussions. So one group will focus on food production and climate resilience. There are 2 guiding questions or prompting questions. And then the second group will focus on food distribution and access. And there are a few questions there. And then the last group, the third breakout room, will have to focus on policy and governance for sustainable food systems. To these questions that the facilitators will share with you, you can try to also discuss some of the questions that have come up in the chat that we will not be able to reflect on because there's no question and answer session. So after this interactive session, we will get some feedback from the chosen people from the breakout rooms, and you will be allocated 3 minutes per group to give some feedback from the interactions. So Solène, Caroline, and Jacqueline will be the facilitators for these rooms. Good afternoon again and welcome back. We will now get into the feedback session from our interactions from our breakout rooms. As I've said earlier, you will have 3 minutes per group to present to us some of the points that came out from your interactions. Thank you to Solène and Caroline and Jacqueline for facilitating the breakout rooms. So if I can have the first group that was discussing food production and climate resilience, please.
All right. Thank you so much, Solin. That was group 1. And we managed to have a great discussion. However, the time was a bit limited, but we had a few very important points by the team. One of the innovations that was discussed was farmer-managed natural regeneration. It was mentioned a project that a few of the people that attended a consultation in Kenya were able to witness by visiting a farmer somewhere in Kenya. We saw the good work that the farmers were doing in their farms. They were able to improve the quality of plants and they had in their farm through this project. They were able to feed their livestock through the trees that they were growing naturally through this regeneration. Additionally, we also looked at the innovation of drought-resistant crops. A member mentioned about working with groups of refugee communities and also communities living in areas where water is quite a challenge. And this innovation of drought-resistant crops was able to support the livelihoods of the people there. they are able to introduce vegetables, nutritious vegetables and fruits that are drought resistant, and it's to give alternatives to these communities because most of them are using pastoralism as their source of livelihoods. They mentioned that the challenge that they have with introducing these crops was the cultural attachment that these communities have to their pastoralism way of life, and they're doing the community education to ensure that they are making them understand the importance of diversifying their source of livelihoods. Another innovation that was mentioned was irrigation, introducing or educating the communities about irrigation systems, especially communities that are close to water sources like rivers, and also uh, water sources like boreholes, um, enabling them to understand that they can be able to utilize the water that's available for them to irrigate their lands and be able to grow food for themselves. Additionally, for the second question about access, there was the issue of women not being able to access land easily because of the challenges that are existing with gender norms. So there was an issue of supporting women to be able to access the land so that they can also be able to use that land to support themselves and also to do the resilient farming. And there was also the point of educating the young generations to understand the importance of resilient crops, climate resilient innovations, so that they can be able to move from short-term solutions to long-term solutions. And lastly, there was a point on we need to move from the logic of domination to the logic of sharing. And there was a point made that institutions like the World Council of Churches should be able to support these kinds of teaching to allow us to move forward. Thank you so much, Soli.
Thank you, Caroline. And if we could have the next group on food distribution and access, please.
Thanks, Katlego. That was me. I was asked to be the scribe and note taker for that group. So we were looking at distribution and focused on three questions. The first question we were asked, and Jackie helped facilitate a complex conversation in a very short time. So very appreciative of that. So the first question was, what challenges exist in an equitable food distribution, especially in conflict zones? That was our first thing. We're looking at equitable distribution within the context of conflict zones, especially. And a couple of points came up that are worth noting. One, we spoke about the politicization and weaponization of food and food distribution, especially in conflict zones, although not exclusively there. And that the underlying resource and power struggles that are happening in conflict are then utilized as well in food distribution. So they become mirrored in food distribution, and that impacts equitable food distribution. Then a conversation around or noting that access becomes restricted, and the driver of that lack of access can be a number of different things. So it can be infrastructure that's broken or wasn't existing, making it difficult. It can be things like weather contexts and storms and the like. And it can simply be that in a conflict situation, access is restricted because people can't move. And then the last bit is that, particularly once again in conflict situations, particularly subsistence farmers but other food producers as well, can't get onto the land to produce because their access has been limited by the conflict. And so those challenges exist: politicization and weaponization, access, naming infrastructure, remoteness, weather, and then also this capacity to produce, which then means that the distribution is unequitable. The second question was that how do we make food distribution systems more resilient to economic shocks? So looking at these food systems and these distribution, and how do we help them resilient to economic shocks? And there, once again, a few things were surfaced. One was that our food distribution systems are adjusted to the needs of a global market and an industrial market alignment of food. And so we have movement of food across very large distances. We have large industrial production that then means that food has to travel long distances and be distant from its local. And so one of the ways we can make it more resilient is the move towards more mixed local crops. And secondly, that we diversify so that we have an opportunity to diversify what's present. And then to build deeper connections between local producers and the people who eat the food and the people who make the food. That way we're not reliant on sophisticated logistics systems with large complex processes and very sophisticated cold chains. We end up with problems. And so building better connections deepens resilience. And then our last question, trying to keep an eye on my time, is what role did we think that local markets and urban agriculture can play in the access to food? And so once again, there were some similarities in this conversation and our previous one. One is to strengthen the local distribution and diversify the local system in that respect. And secondly, to build local access to diversified crops. So that one of the challenges, for example, in urban Cape Town is that everybody grows spinach. And so although you've got urban production, it's all spinach. And so how do we build a diversification with things like that? Thirdly, invest in local agriculture and local distribution mechanisms, things like local farmers connected to local markets. So take subsidies away from large-scale industrial agriculture and large-scale distant agriculture and invest some of that subsidy into local farmers and local markets. And then lastly, there was a point made about finding ways of addressing food wastage. That means that we're losing a lot of the food that can be eaten in the system. So I hope I represented our group well and got it in on time, Katlego.
Thank you, Craig, just in time. Can we have the last group, please, on policy and governance for sustainable food systems? Thank you.
Okay, I will try to do my best. It was a real honor to be in this group of discussions. We really had great discussions and professional advices. And I can summarize that we have at least two general views. These subjects or questions have been addressed for the national level and also for the international level. For the national level, in the center of attention, we have the governance and also responding to the second question, the stakeholders plus the church, and of course, local people. They are the main subjects of our discussion. And of course, based on the conclusions I can depict from these discussions, I can say that we may see also top-down and bottom-up approaches in order to further develop our policies for incentives and also for subsidies we need to address in this case. And I can add a major role to reach the affordable price for families that are closely related to the market price. This affordable price is really important, not only for one country, for many of the countries, and some connectivity in subsidies may help based on synergies that can be defined with other subsidies from different kind of policies. And as an example here was mentioned the fuel cost that has rise also the price for the food, which it's unaffordable into the market. And if we are talking about not production in the crops fields, then we can say that the people cannot afford to have enough food in their houses. So another one relevant subject that was mentioned, it was justice to mobilize these kind of resources. So we have depicted a couple of subjects really relevant, and at the international level, as a view, it was raised the attention of trying to put a lot of pressure to the FAO meetings for food security. I hope that I covered all the subjects at the general view for all my colleagues in the group. Thank you.
Thank you, Mihaela. And thank you to all the participants and all the groups that have shared their insights. Please feel free to share your thoughts in the comments. We've seen a few hands that we are not able to engage with now, but please feel free to keep the conversation and the interactions going in the comments. We are now moving into our third session, where we will hear from Solen Jetsa, and she will speak to us about the Nutrition for Growth Summit 2025. Solen is a food security and nutrition expert with experience in enhancing national nutrition policies, implementing public health programs, and developing sustainable products with innovative ingredients. She is currently a consultant for the World Council of Churches, focusing on the Living Planet program. Thank you, Solen.
Thank you, Katlego. I'll just ask if my slides could be shared. Thank you very much. So I just want to briefly have more of a global perspective around the topics of nutrition and food security and how they're intertwined and how we have to think about them together. And then just highlight a few policy mechanisms and events that are happening around the topic of nutrition and hunger in the first trimester of 2025. Next slide, please. So we have heard many impactful statistics from Dorothy and the first speakers in the first session. We know that we are facing a terrible crisis in terms of nutrition and hunger, and many factors today, such as climate change, economic volatility, conflict, inflation, supply chain disruptions, are all exacerbating this crisis. And we know that if we do not act now and change the way we produce our food, they will have drastic consequences for the most vulnerable, including women and children all around the world, and specifically in developing countries. So we cannot talk today about the status of nutrition and wish to break the hunger cycle without also incorporating the subject of food security and how we manage our food systems. Resolving hunger can only be achieved if we completely rethink the way our food is produced and distributed around the world. Next slide, please. So what do we mean when we talk about food security? So food security encompasses four key aspects. The first, we have to talk about availability. So availability means sufficient production of food, be it nationally or from imports. Access means the ability to afford the food that is available and also be able to access geographically. Many times people who are in vulnerable communities do not have the possibility to even go to a market to purchase the food that is available. Stability means that the food systems that are in place can withstand and are resilient to shocks or crises, so that there is still food available when there are shortages or climate crises that could affect food production. And finally, utilization, which is the point that most intertwines with nutrition. So utilization looks at how the food is used within a home, within a family, within a community. What are the standards used, be it the utilization and the the food is being used safely, respecting hygiene standards, but also what type of food is being used, and does it respond to the nutritional needs of the population? And so all of these four aspects are key when we're talking about policies surrounding food security and nutrition, and how can we make sure that all of these four aspects can be fulfilled within a community, within a family, so that they are in a state of food security and therefore can meet their nutritional needs. Without these four aspects, we will never be able to solve the nutrition crisis. Next slide, please. So finally, I would like to talk about a few events and mechanisms, policy mechanisms that will be happening in the next coming months that are focused on nutrition. So 2025 is a very important year in terms of nutrition, as it marks the final year for the UN Decade of Action on Nutrition. And new targets by the UN will be set within the Conference on Nutrition for Growth that will be happening in Paris in 2025. So this is an international conference that is held every 4 years with the objectives to rethink how we can respond and what are the solutions towards the nutrition and hunger crisis, and also make sure that there are the financial means to respond to these crises, be it from government or private sector. There has also been preliminary nutrition dialogues that have been organized throughout 2024 that aim to amplify the voices of the most vulnerable, so women and children. These are really important, and the WCC is also alongside World Vision, who is also represented in this webinar, have been implicated in one nutrition dialogue that was held last Friday in Geneva as part of the an event on I'm missing the event.
WOPA.
WOPA event. Thank you very much. Apologies. So a weekend of action and prayer on hunger. Apologies. That was held last weekend. And so these nutrition dialogues aims to collect the voices of the most vulnerable, to be able to bring these forward during the Nutrition for Growth event. The conference. The WCC will also be participating in the Nutrition for Growth conference alongside Bread for the World from the USA and from Germany, as well as other members from the WCC's network of church members. So these are all important events that we are participating in, and that we also invite you to attend or to follow, as they will mark very important initiatives and actions towards solving the hunger crisis. Thank you very much.
Thank you very much, Celine. We will now get into the fourth session, where we will hear from Dr. Manoj Kurian on the role and commitment to food security, nutrition, and access to health, as well as Mr. Dinesh Suna, who is also coordinating the work on land, water, and food justice, and both will speak on the role and commitment to food security from the WCC. So Dr. Manoj is a specialist in public health who has experience in advocacy and program management and partnerships in healthcare, and working with civil society networks and non-profit institutions. He is strongly committed to human dignity, equity, and justice. And until this year, he led the work on Food for Life campaign and is currently the director of the Health and Healing Commission. Thank you, Dr. Manoj.
Thank you very much, Katligo. So I think we'll just have to shorten, because of the time, I will just try to shorten the presentation. But I think what is important for us to is to just to highlight. I will not repeat what has been said already, but the food campaign is part of the WCC's mandate, holistic mandate that addresses land, water, food, and food in a holistic manner. Of course, it has a vision of a world free of hunger, where everybody is, entitled to live a full life. And of course, we also strive to look at the root causes, in particular, with particular emphasis on sustainable agricultural practices and situation of smallholder for producers, etc., and the control of land, water, and seed. Now, overview in the sense, there are a lot of processes that WCC, where information and facilitates reflections, as this week is going through, and we have worked with many partners. Thank you for partners who are there in this call, the prayer, the weekend of prayer and action, the Church's Week of Action, of course, linked with the Lenten campaign, second 7 weeks of water, season of creation. There is also aspects of capacity building and advocacy, and we have, Living Planet Monitor. We will not go. I will not go into the details of these things, but of course, I think we have had enough of discussions on malnutrition. I'll skip that. But I just wanted to highlight some of the aspects of the world hunger. Some highlights. You have received all this information already, but just to say that the conflicts are playing a huge role. And huge proportion, the highest level of displaced people in the world after Second World War, and 77% of the people, are who are hungry are in conflict zones. I don't have to re-emphasize what's happening in Gaza and Sudan. Tremendous challenges, and of course, most of the conflicts are happening in regions which are very rich in natural resources. So it is also linked to globalization and unfair practices, and we have statistics again showed us that children and women are in the forefront of the hunger crisis. Women are 1.3 times more likely to be affected by food insecurity, but of course 70 to 75% of food production is done by women, but only 20% of the land is in their names, and 45% of children's deaths worldwide are due to hunger. So it's also in the discussions it came up. The people are not able to afford, and they're pushed into industrially produced ultra processed food. So the environments and the markets and the nutrition and health and all are interconnected. And of course, these pictures show the industrial palm oil production in Indonesia. You have the Cerrado habitat in Brazil, which shows stark contrast of the forests and the soybean cultivation. Just to remind that 80% of world soybean is given to livestock. And there's, the last week, the Living Planet report of 2024 shows this catastrophic decline of 73% of world wildlife population. Huge challenges. I just want to connect up. It is the holistic perspective. There's huge impacts on the environment. The water, the lands are being impacted. So the climate change and all the environmental challenges are directly impacting food and livelihoods. So the warming water, the increased climate, over the 50 years, 5-fold increase in natural disasters. Even the recent cyclones in Florida, they have not seen anything like that over the last 100 years. So it's becoming very, very common and very damaging in most parts of the world. And of course, the biomass of humans are increasing, and most, just a few examples, biomass of domesticated poultry is nearly 3-fold higher than any wild birds. And of course, we are getting into a very unsustainable cycle. And of course, most of these chicken are broiler chickens, and most of the breeding is from a very, very few number of companies own these genetic, breeds, commercial lines, and also to see that a lot of nearly a quarter of world's greenhouse emissions are due to food production, especially the industrial food production. So the food and climate, they are mutually, impacting. What can we do? So briefly, we need to adopt sustainable lifestyles. We need to shift from industrial modes of agriculture. We need to plant trees and have kitchen gardens, promote agroforestry, afforestation. We our discussions were clear. The reports are very clear. All these are already reflected from your discussions. We have to encourage locally grown, sourced, and prepared foods, and reduce dependence on imported foods, and of course advocate against land grabbing and grabbing of water bodies, and promote and protect indigenous communities, their knowledge, the biodiversity. They are the caretakers of the biodiversity. Indigenous peoples live closest to the Mother Earth. They are, they are only about 5% of the world's population, but they are, and hold about 25% of the land. But indigenous peoples, those lands contain nearly 80% of the biodiversity, and they are facing a lot of challenges. The gender justice issues was highlighted, and I also already told you, those 70% of agriculture is done by women, where men are forced to go to the urban areas for work, but titles, only 20% are on women. Promote blue communities, promote alternate sources of energy consumption. Let's promote practices that prevent waste of food and water, and promote alternate financial models at the community level. We have good examples of resources. A roadmap for a just and sustainable community is there. We have the 10 commandments of food. We have guidelines to promote climate justice, and we have to challenge the policies and subsidies that undermine sustainable living. Finally, what needs to be changed? These are questions we have to ask ourselves. What needs to change, and how can we be part of the change? I would like to conclude saying that look at yourself and look around and see beyond. I will stop now because of the shortage of time, and pass it over to my colleagues.
Thank you, Dr. Manoj. And still from the WCC, we will hear from Mr. Dinesh Suna, who coordinates the work on water justice, as well as the Land, Water and Food Justice Working Group.
Okay, thank you so much, Katligo, and thanks, Manoj, for highlighting some of the key engagements of the WCC, showing the commitment of the WCC towards these issues around food justice and issues of food security and nutrition. Yes, and I think I do not need to repeat. A lot of those statistics have been provided by many of our speakers, including Dorothy and others, and including you, Manoj. But these numbers are not just statistics. These are real human beings and their sufferings that cannot be ignored or overlooked. And therefore, the issue, the commitment of WCC and other partners, governments, is very important. And along with others, the increasing wars and conflict are furthermore exacerbating the situation of hunger. And that was exactly what was highlighted as Katligo and Solen mentioned in this previous last week's event, the Weekend of Prayer and Action Against Hunger. I would like to basically say something what we at the WCC are trying to do to address the issue of hunger and food insecurity and lack of nutrition in a more holistic manner. And therefore, we do agree that food hunger or food security issues cannot be addressed in isolation because they're intrinsically related to each other. And they relate to the broader issues of land. They are related to the issue of water. And all these three are linked to climate change, which further exacerbates the impacts. And therefore, it is important to recognize a nexus approach between these three, including climate change. Therefore, we may be able to respond more holistically and intentionally. And therefore, at the Living Planet unit program, later on we'll hear from Athena, the director of this program. But we are trying now to more intentionally address these issues, not in isolation, but holistically. We are also particularly engaged in publishing a publication called the Living Planet Monitoring, which basically is providing the status of the situation of hunger, the situation of water crisis, or the issues around land in various parts of the world, and trying to extrapolate all these various statistics, reports from various credible sources that are all there, but compiling them and in one place. And then also at the same time, if these are the problems, what are the other stakeholders are doing, including our member churches and faith-based organizations, etc., and build those case studies and those good practices. So on one hand, highlight the problems, on the other hand, showcase the solutions that are at place. So the first issue is focused in East and Southern Africa, and this is all due to be released by next month. This would be the first of its kind, and then would continue this process. At least twice a year, we will publish this issue, which would, food security related issues, therefore, would be a significant part of this publication, but not in isolation, but in connection with water crisis, in connection with the land related issues. We would continue the Living Planet monitoring, and all of you are potential contributors of this issue. And finally, I want to remind us, the World Council of Churches is a fellowship of churches, and thereby, as faith communities, we are the first responders. We have that moral imperative to respond to these issues of justice and human rights, and thereby we do have that potentials. And also, it came through several in the group discussions as well. So finally, I also join others in the call to all member churches and faith-based organizations on behalf of the WCC to come and engage with us. And this webinar was one initiative of that commitment. And we are, after 5 days, as you know, next week, we will start the UN's Food and Agriculture Organization in Rome. We will be having the Committee on Food Security 21st to 25th of October. And we are having an event there with the United Nations Special Rapporteur on Right to Water, and the UN Special Rapporteur on Right to Food, and the World Council of Churches Ecumenical Water Network, and the Living Planet. We are doing a joint event on 22nd of October. Please look out for this program. We'll share more details. So I would stop here, Katligo, in the interest of time, and hand it over back to you.
Thank you, Dinesh and Dr. Manoj, for highlighting the role and our commitment as a WCC to these issues. We will now hear from Ms. Athena Peralta, who is the Director of the Commission on Climate Justice and Sustainable Development, under which the work of the Living Planet Monitor that Dinesh has referred to, as well as the work on land, water, and food justice finds expression. Thank you, Athena, and thank you for closing the program for us.
Thank you very much to everyone who has stayed till the very last minutes. Thank you to all of you who shared their experiences, shared their wisdom, and their perspectives. And I think my task is simply to highlight now some of the key takeaways from what we heard today very, very quickly. I heard that we have to look at this issue of hunger in terms of systems. I heard that if we are going to address the issue of hunger, this entails nothing less than a revamp of our food systems. It entails nothing less than a revamp of our economic systems, the way we produce our food, the way we distribute our food, how do we invest. This is also very much about our ecological systems, the land, water, forests. How do all of these things contribute to more climate resilient food systems? And of course, I also heard that hunger is at core an issue of justice. It's an issue of economic justice. It's an issue of ecological justice. It is definitely an issue of gender justice. And I think we in the Living Planet program understand that we have to deal with these issues as a matter of justice. Our faith, we are faith-based people, we are a faith-based community, and our faith clearly calls us to prioritize those who are in the margins of society, those who are being left behind. But this is not simply about addressing their needs, but also looking to those who are most affected by hunger, by the economic and ecological crisis, to look at those who are most affected, those whose voices are not being heard. This means youth, women, indigenous peoples, looking to these communities for their leadership, for alternative pathways to addressing these issues that are nothing less than matters of life and death. So I just wanted to say thank you to everyone who contributed to this very rich webinar.
Thank you so much, Athena, and thank you to all of you for contributing. May you all have a good evening or great further day. Thank you.